All right, welcome to The Explainer. Today we're diving into something really fascinating, a new way of looking at bipolar disorder. This is all based on an article by Dr. Adam O'Brien, and he suggests there's a whole other layer to this condition that we don't often talk about. So yeah, let's just jump right in.
So, the whole thing starts with this really big question. What if we've been looking at bipolar disorder a little, well, narrowly? What if it's not just about mood swings? This is the central idea that challenges us to dig deeper, to look for something that could totally reframe how we see this.
Okay, so before we go any further, let's do a quick reset. The classic definition of bipolar disorder, or BD, is all about those major shifts, right? You've got the highs of mania or hypomania and the lows of depression. Mood, energy, concentration, it all swings. This is our baseline, this is what we all kind of know. But we're about to add some new layers to it.
All right, so if it's more than just moods, then what is it? This is where things get really interesting, because the article points to a connection that you might not expect.
And here it is. The central idea is that bipolar disorder is deeply, deeply tangled up with two other things: dissociation and, often, childhood trauma. The key takeaway here is that these aren't three separate boxes. Nope, they're all connected, feeding into each other in this complex web. So, the big question is, how? How do these things actually link up? Let's break down what the research in the article says.
Well, what's fascinating is that when you look at the research, a really clear pattern emerges. Study after study shows that folks with bipolar disorder have way higher levels of dissociative symptoms than you'd expect. And when you trace it back, there's often a history of childhood trauma. We're talking things like emotional and physical neglect.
In this table here, it really helps visualize it. It's not a straight line, like A causes B, which causes C. It's more like a triangle. You've got childhood trauma as this major risk factor, which can trigger dissociation as a way to cope. And that dissociation, it becomes a huge present feature within the bipolar disorder itself. They're all reinforcing each other.
I love this analogy the article uses. It makes so much sense. Think of dissociation as the mind's emergency exit. When things inside get just too intense, too overwhelming, the mind pulls the fire alarm and checks out. It's a survival mechanism, a way to escape. It's brilliant, really. But as you can imagine, relying on that exit all the time can cause some major issues down the road.
Okay, so we've got the theory, but what does this look like in real life? How does dissociation actually, manifest in someone with BD? The article highlights 4 big ones.
First up, identity confusion or alteration. And yeah, this goes right to the very core of who a person feels they are.
And we're not just talking about feeling a little unsure of yourself. This is a much deeper kind of disruption. It's that feeling of your sense of self being slippery, constantly shifting. It's a real struggle to pin down, who am I? And that creates this feeling of being fragmented inside, which is a whole different ballgame from just being in a good or bad mood.
Number 2, amnesia and memory gaps. And again, this is way more than your everyday, what did I put my keys, forgetfulness.
We're talking about losing chunks of time, significant gaps that make your own life story feel like a movie, with scenes missing. It creates this really fragmented personal history, and it's almost impossible to build a solid sense of self when you can't remember your own story. And research shows this gets more pronounced the longer the illness goes on. Okay, the third one is emotional dysregulation. And this one's a real paradox, right? Because you'd think dissociation would just numb everything out, but it can actually do the opposite too.
So here's the kicker. That emergency exit we talked about, it might turn down the volume on your feelings for a little while, but that pressure has to go somewhere. So it can lead to these massive heightened emotional reactions later. And what does that do? It can make the mood episodes in bipolar disorder even more severe and happen more often. It's a vicious cycle.
And the fourth and final point connects all of this, trauma and dissociation, to some of the symptoms that are, let's be honest, the most misunderstood and, frankly, the most stigmatized.
So the idea here is that some experiences that get labeled as psychotic-like, things like depersonalization, where you feel like you're watching yourself from outside your body, might not be what we think. They could actually be an extreme form of dissociation. This totally reframes it, right? It's not just a random symptom of psychosis, it's a direct response, a protective mechanism that's been dialed up to 11 because of past trauma.
Okay, so this is all really interesting theory, but what's the point? Why does this matter? Well, it completely changes the game when it comes to treatment and healing.
This quote from the article really hits hard. It says everything. If you just focus on the mood swings, on the symptoms, but you never address that deep, fundamental drive to escape, well, the problem's still there, isn't it? The root cause is unhealed, and that makes real long-term recovery so much harder.
And you can see the difference right here. The standard approach often focuses heavily on medication to stabilize moods, which is, to be clear, incredibly important. But this integrated approach says, yes, let's use medication, and let's also use psychotherapy to get to the root of the trauma and dissociation. It's the difference between just managing the smoke and actually putting out the fire.
So what does that path to healing actually look like? Well, it's a process. Step 1 is just to recognize that dissociation is even happening. Then you can begin to address the trauma behind it. After that, it's about integrating those fragmented experiences in therapy, putting the pieces of the story back together. And finally, and this is so key, it's about developing new, better coping skills so that emergency exit isn't the only option anymore.
So here's the main takeaway. This idea isn't about throwing out everything we know about bipolar disorder. Not at all. It's about adding a crucial missing layer. It's about seeing the whole person and the whole story. By looking at it through this lens of trauma and dissociation, we get a much more complete picture, and honestly, a much more hopeful path to real, lasting healing.
And that really leaves us with one last big question to think about, doesn't it? What if this is the future of mental health care? What would happen if we started focusing just as much on the why, the origins of our pain, as we do on managing the what, the symptoms? Imagine that. It's a pretty powerful thought.